Hi, my name is Lynn Serena. I'm a speech pathologist from Bethel Park School District, and I currently work at Independence Middle School and Bethel Park High School.
Hello, my name is Maureen Swagger, and I am speaking regarding speech-language pathology career opportunities. No one? No one's going to answer? All right, I said hello, how are you? And how are you today? Mrs. Serena answered that she is good. Sign language is one of the aspects of some of speech pathology that you might be interested in. And one of the things that we're going to talk about is just how many choices there are. There are tons and tons and tons of choices if you go into this major. And that is in types of services provided and career opportunities that we're going to get to in a second. There's just many different avenues and different ways that you can kind of make your career. So we're really happy to have you all here. My name is Maureen Swagger. I work in the district here. I'm presently at Memorial Elementary, but I've worked in all of the buildings at some point, at least doing screenings. But I started at IMS in the high school, and this is Ms. Serena. She'll introduce herself.
I am Lynn Serena. I am the speech therapist here at the high school and at Independence Middle School, and I've worked here for about 14 years, and I've also worked at Franklin Elementary as well. I primarily work with the life skills and autistic support students here, so it's a little bit different than what Maureen does at the elementary school. Have any of you ever received speech when you were in elementary school? Does anybody ever remember going to see a speech therapist? You do? And what were you working on?
I had issues with braces.
Okay. Anyone else?
What school?
Washington.
Yeah, Washington.
So you had Mrs. Wessel?
Mrs. Wessel?
I wish so.
Okay. No one else?
My cousin did.
Okay.
She had a list.
Okay. Here in Bethel, or what school was she at?
I think the same.
Okay, Washington.
Oh, must be some in the water. All right, great. Basically, the undergrad is called usually speech and hearing science or communication disorders. There are several different schools that offer the undergrad, and you can look down at the bottom and they'll give you a list of several of the schools. We didn't include them all. These are just some of the ones that we know. I personally went to Teal for undergrad. It's a very small school. I got a lot of individualized attention. The largest class I had was a health class, which was just a general class. It had 70 students in it. All my major classes were anywhere from around 7 to 10. And then when I went there, they had a wonderful program where I spent the first semester, my senior year at Pitt, where I was taking all the courses that Teal wasn't able to offer, like oral rehab and the anatomy classes. But there's lots of different things that you can do, different educations, schools that you can go to. But the main thing is that undergrad degree is very limiting. When you graduate with your BA or your BS, you are unable to work as a speech-language pathologist. You have to go on for your master's degree. And it is getting increasingly very difficult to get into grad schools. So what we're finding out is a lot of schools are going to accept you for undergrad, and then guess what? You graduate and you're having difficulty getting into graduate school. So you got to really think about that when you're considering this as a major. I love it. I think it's wonderful, but it's kind of like going to school for pre-med. When you get out, you can't get a job. Now, if you go into biology, then you might have other options or whatever. Speech and hearing science, you're limited. You're going to have to go on for that master's or switch careers. So really kind of consider that while you're making your decisions.
I would also recommend, if you are choosing a school and you do want to go into speech pathology, choose a school that you have some other options in education for, on the off chance that maybe 2 or 3 years into undergrad, you decide, hey, this isn't for me, but I'd really like to be a classroom teacher. Some of those credits will transfer to an education degree as well.
Yes.
So I would look at that, look at a
I'd say
school that
most
has a
of them.
lot of options for you in the education area.
After you get your master's degree, you also have to work for a year. It's called a CFY, or a clinical residence type year, where you're basically working, getting paid, but usually at a smaller salary, while you're still learning and you're being supervised. Then after that, you have to take a national examination. It's called the C's.
NESPA.
Yeah.
That's
Now
it.
they've changed it.
Oh, have they?
Have they changed the name? I don't know. That was a couple of years
You
ago.
end up with your certificate of clinical competence after you take this examination, which is pretty pricey. And if you don't pass it, you obviously have to take it again. It's around a $500 test.
Yeah. But I mean, I felt it was the easiest test I ever took. I went to Pitt for graduate school, very well prepared. When I took that exam, and I did not do well on my SATs or my GREs, so it's not that I was this amazing test taker, but if you are prepared, you shouldn't have any issues passing that exam. However, if you don't, again, you're not going to be able to get your degree, and then you're not going to be able to be hired. Right now, yes.
Can you also just explain to them that like the bachelor's is 4 and then
Okay.
what the
Yes.
master's even is?
Yeah, the bachelor's degree is a 4-year degree, and then the master's is usually around 2. It used to be somewhere around 15 months, but I think now most schools are 2.
It's around 2 for masters, and you also have to do a placement, sort of like a substitute or student teaching, but it's called an externship, and you would do that in a medical or clinical setting as well as the school setting. And it varies between what college you attend. I attended Clarion for my undergrad and graduate, and for my graduate externship, I was at Franklin Regional for 8 weeks, and then I also went into an acute care facility, which is like a nursing home, and I worked with stroke patients for another 10 weeks. And then I was able to graduate after that.
So you're looking at 6 years plus exams plus
Yes.
externships
Yes.
and practical experience.
Yes,
Make sure.
Yeah,
you guys are
6
on the
years
same
probably
page.
minimum, yes.
yes. And then plus your year of clinical fellow after that.
All right, some of the career opportunities. If you look there, that's the second section there. Early intervention, birth to school age. This can be a lot of different things. There are different hospitals that hire people to see children from birth to preschool, and you're probably wondering, well, speech, what does that have to do with infancy? Well, as an infant, swallowing is one of the big issues, usually when you're dealing with infants. Any child that has any swallowing issue, again, that's our realm. We're going to be evaluating, doing feeding therapy, those different types of things, swallowing therapy, to try to get that child to be able to eat. I presently have a child at Memorial. She is 5, and she's on a G-tube, and which is a feeding tube. She gets almost all of her feeding through her stomach. And what I'm presently doing is trying some pre-feeding skills. Sadly, it was not done when she was younger. So we're just trying to get her desensitized to things by her mouth. Even brushing her teeth is a problem. So we've been using different techniques and different things like that every single week to try to get her to feel more comfortable. So when we think of speech pathology, as I said, when I talked about the different choices, there's so much. Feeding is one, swallowing is another. Children from birth to school age or to preschool age is one. You want to do the next one?
Yes, the next group would be school age, which would be kindergarten through high school. And that could encompass everything from swallowing through articulation, like you can't say your R sound or your S sound. Overall communication, we have a lot of students who are unable to communicate. They might use devices to communicate, augmentative communication. Those would be mostly your autistic support students, life skills students. You would work with a lot of Down syndrome, Fragile X, autism, things like that in the school. Maybe deaf or hearing impaired, so that's where the sign language would come into play. Kindergarten, school age has a lot of opportunities. However, once you are working in a school for so long, you lose out on those like nursing home, adult type care skills.
Now, I personally love it, and I've done all that. I've worked in the nursing homes. I've worked in the Cleft Palate Center at the University of Pittsburgh. I've done long-term, short-term rehab. I've even done some hospital work, as well as private. But I love it here in the schools. One of the things that's the most rewarding about being in the schools is you see progress. When I was working with adults, especially with stroke patients, you would see some progress, but then they would have another stroke or they would die, and it was very upsetting. And I could only do it for a couple of years. Whereas here, you're seeing tons of growth, and a lot of my students I'm still checking up on because they're still in speech because of their disability. With Miss Serena, I'm like, oh, how's that student doing? And so you're still seeing that progression even clearly through high school. And our jobs are so different. Like Mrs. Serena had said earlier, my job is so different than hers because I'm seeing those kids right at preschool. I'm evaluating them, getting them in even before they even start school here at Memorial or within Bethel Park School District. So I'm dealing with these young kids that are just learning how to talk. One of the downsides of that is I'm the first person many times to tell parents, you know what? Your child has some issues that we need to address. He might have some delays or he might have autism. These are different things, and sometimes I'm the first person to bring that to their attention, and that can be a little unsettling for them and for me.
And on the flip side of what Maureen's talking about, I work with the high school age students a lot of times, the special needs, and I'm on the other side where I'm dealing with parents with what do we do next? My child is now 21, can no longer be at the high school. What do we do? Because there's limited options out there for those children to have a job or even have someone to take care of them throughout the day. So that's a different side than what Maureen would see. And a lot of times she's working, she sees a lot of progress. By the time they get up to me, mostly I work with the special needs kids, we're maintaining them. They're where they're at, and we have to maintain that communication functionally to get them through the day and possibly for a job.
The next thing is hospital. Kind of talked a little bit about that. There's two main types of hospital, and it kind of goes with the acute care and the home care type thing. There's a continuum. I have friends that work in the acute care hospital setting, so they're seeing these patients right after the stroke, right after their laryngectomy, where they have their voice box removed and they no longer are able to talk. So they're working with those patients immediately after any type of incident or surgery. They're giving them immediate communication. Maybe that is some type of augmentative communication, such as a board, or it could be something as simple as a wipe-off board, or now with the phones, we're using them to communicate as well. There's different things that they can point so they can talk. I'm in pain, so that they can talk to their physicians. With the laryngectomies, they're teaching them how to talk without having a larynx anymore.
My husband also works in an acute care facility. He's a speech pathologist as well. So he deals a lot with the immediately after stroke consequences, things like that, learning to communicate. He has a lot of elderly patients on devices to communicate, and like Maureen had said, whiteboards, things like that, to communicate their functional wants and needs, such as, I need a drink, I'm sick, I need, medical attention, things like that. So it's a lot different. His perspective of speech is a lot different than mine. There's pros and cons to it. I think the pro to that is you're working with families closely during it, along with nursing staff, doctors. It's more of a medical aspect than in the school. A con to it is your schedule at a hospital or nursing home facility. You might have to work weekends. You are there. My husband can go in at 6 a.m. and he might be there till 7 p.m. Just depends on the caseload. Whereas in a school, we have our set hours. Do we do paperwork outside of school? Yes, but our hours are pretty set. And we also have holidays off. My husband doesn't have holidays off. He has to take paid time off or actually go in on Christmas. So there's just different pros and cons. Yes, he does. So those are just things to look at when you're out there looking at jobs. You need to make the list of what you want in a job.
It is fun and exciting, though, to be working with those different types of things. In my bio, I kind of talked about the different jobs that I had and how you coordinate that care. Here, we're coordinating with the school psychologist, with the teacher, trying to get the most out of our students together, as well as even the parents and the principal. Whereas in a hospital, you're working with the nursing staff, the physicians. When I worked at the Cleft Palate Center, I was working with orthodontists, with plastic surgeons, with pediatricians, with audiologists, all working together to try to coordinate the care, because you can't just look at that one little spot. You have to work together, and it can make it kind of exciting. Let's go down to types of services provided.
The first type of service would be expressive and receptive language disorders, which are any time you have trouble with vocabulary, expressing yourself, using complete sentences to talk. A lot of times we work on this mostly with our special needs students, but there are some regular ed students as well, and it would just be vocabulary integration, like using some curriculum words to help them. We do different strategies for memory, defining the words, understanding them, things like that. Following directions is a huge one for especially the little kids, just so they can be in class and understand what the teacher is saying. So we help them a lot with that. The next category would be stuttering, which would be fluency. I have a few students, my son actually stutters as well as my husband, and it's when you have a break in your speech and you get stuck on a word like I, need to go to the bathroom, things like that. So we provide different strategies on how to slow yourself down, how to regulate your speech, how to listen to yourself speaking. That's a pretty tough one because a lot of times stuttering is affected by anxiety. So if you're really anxious about something, like I know I don't like to speak in front of large groups, sometimes I would stutter. That's not a true disorder, but there are a lot of kids who do have it here at the school, and it's triggered by a lot of other things as well. Maureen will talk about voice disorders.
Voice disorders could be a variety of different things, and I used a lot of this when I worked at the Cleft Palate Center. Children that have cleft palates sometimes are left with a mechanism that doesn't work as well as yours and mine does. And basically, when you're talking, your palate needs to move. It needs to close off. This would be the hard, bony part of your palate. This is the soft palate. The uvula, the little thing that sticks down at the bottom, is right there. And so when you talk, it's going up and it's meeting the back part of your throat, closing off your nose from your mouth. If it doesn't, you're going to sound kind of like this. This is what's called hypernasality, and this is because I'm allowing too much air to go through my nose when I'm talking. Then there's the opposite, which would be hyponasality. Oh, you're laughing at me. Good, I like it. Hyponasality is where you don't let any air go through the nose. You've got to sound like you have a cold. All right? So, I have this. Does anyone know what this is? Of course you don't. It is a Floxite mirror. It is a heat-sensitive mirror, and I use this. I carry it around with me all the time. I used this initially at the Cleft Palate Center to evaluate. Again, if I'm saying I'm closing off my palate when I'm talking, except for 2 sounds, 3 technically, do you know any of the sounds that you'd want the air to go through your mouth? Nose. Scratch that. Reverse. Through the nose. Any sound that you make through your nose. All right, I'm going to give you a choice. I'm going to give you 2. The B sound or the M sound. Everybody together. Ba. Come on. Ba. M. Which one do you think goes through your nose? Laugher? It is the M sound. Very good. All right, I'm not even going to pick on you. I'm going to pick on you. All right. All right, so to make the M sound, I want to see lots of air coming through the nose. So say M. Ooh, look at that. Can you see that? Here we go. Again. M. There you go. If she was hyponasal, she wouldn't be getting that air through the nose. Now I'll say ba, ba, ba.
Ba, ba, ba.
She has no air. I'm always worried I'm going to pick the wrong person. They're going to have air coming through. All right. This has actually helped me even in my job here. All right. It has helped me to identify different types of things and disorders that I've called the parents and referred them to talk to their pediatrician. There was a child that had vocal nodules. There was a child that had nasal polyps. And I said, you know what? Your child is always hyponasal. When I use this mirror, there's just very little air escape, even on when they're just breathing. Or a mouth breather. It's not really interfering with his speech right now, but I am a little worried that it might, but I do think that you need to talk to your pediatrician about it. I went to the pediatrician said, oh, there's nothing wrong. Parent ignored the pediatrician and went to an ear, nose, and throat doctor who said, oh my goodness, this child has the largest nasal polyps I have ever seen. I'm surprised this child can breathe. I'm surprised this child doesn't have major sleep apnea. Removed the nasal polyps. The child is speaking better, breathing better, eating better. And the doctor kept on saying, now, who referred you? And she said, my school speech pathologist. All right, so again, one of those times where you are the first person to maybe identify something. The voice disorders, I would be watching a student who always had this kind of raspy voice. Again, I could understand him. It wasn't any major deal. So the first thing I had to ask the teacher, is this a child that yells all the time? No. Is this a child, called the parents, is your child one that's involved in sports where they're always outside, yelling in the cold or whatever? No. Why? The parent said, well, I'm concerned because I've been watching your child now for 2 years, screening them occasionally, and I'm always hearing this raspy voice. Are they on any medications that might dry things out? No. Again, referred them to the pediatrician. Sure enough, there was something growing in the throat that needed to be removed. All right? So again, it's a very exciting type job where you are, working with lots of different people. You might not be working with that student in therapy all the time, but you're doing this evaluations constantly and helping out families. All right, the next thing is articulation disorders. We kind of talked a little bit about that. That's the lisp, Pfister. Again, you can understand a person when they have a lisp, but it does set them apart. All right, I always seem to find that the hardest ones to fix are the kids that are in the gifted program because they just don't care. They just don't care what their speech sounds like. And I'm like, really? You're going to be a doctor, you're going to be a lawyer, you're going to be a CEO someday. You really shouldn't be talking like this, okay? So again, it seems silly, but it is. It is small little things that we work on to try to help kids communicate better. My little child that is the nothing by mouth has the worst speech I think I've ever worked with. Completely unintelligible, but never stops talking. And someday I'm going to hopefully get her to a point where I'll be able to understand that.
I am sure
So
she'll
it can
come
be
see me.
extremely rewarding.
Also with articulation, we as a district, we screen everyone that comes into kindergarten using an articulation screening. So I'm sure when all of you came into kindergarten, you went through that process where we would ask you, show you some pictures, you tell us what the picture was, and that's when we were checking to see if your articulation skills were at the level they needed to be at for kindergarten. And we also checked to see how your fluency, your stuttering, if you were stuttering, any communication, if you were able to formulate a sentence, things like that. So every single one of you in this room, if you started out in Bethel in kindergarten, went through that process. If you can remember it, maybe not. The next area is apraxia of speech. This is when you have like a motor programming problem in your brain. You know what you want to say, but you just can't coordinate those movements from your brain to your mouth to say those words. That's a lot of times we would use a device for that, try and get these kids to also verbalize, like just different sounds, things like that. Try to get that connection going from your brain to your articulators, which would be your tongue, your lips, your mouth, your oral structures in your mouth, things like that. The next would be cognitive skills, such as problem solving, reasoning. A lot of kids have a lot of trouble figuring out just different problems you would see in school. This happens to my locker, I can't get it open, what do? I have a lot of students that just stand there at their locker. They have no idea that they need to go get a teacher to help them open it, things like that. So that's a lot what I work on with the older kids, is reasoning things out, saying, hey, I need to stop, I need to go ask for help. And it could be at the locker, it could be in classroom, it could be, you go into McDonald's to order food and they stand there at the counter. They have no idea how to say, I would like a Big Mac, things like that. So that's a lot of functional skills that I work with primarily with my students here. The next group also ties into me would be social skills. This is a lot of just your general conversation. You might see some kids in the hall that are right up against you the entire way down the hall. This makes you feel really awkward. I know it makes me feel really awkward. Those kids don't have that awareness that they shouldn't be right up against you. So we try to do some social groups, teach them different techniques to use to talk to someone appropriately. How do you have a conversation? A lot of kids I work with don't even know how to say hi. They don't know how to start that conversation or even what to talk about. They may only have one main interest, which would be computers. And if you don't like that interest, then A, they're going to talk your ear off about computers, or B, you're going to walk away and just leave them standing there. So it's a lot of things we try to teach them, just different topics to talk about, how to say hello, how to end a conversation, how to join into a conversation, things like that.
Let me interject a second. Regarding social skills, too, this is something that you would also be working with adults, especially stroke patients. Lots of times what happens is when, depending on where the brain was affected, it affects how they're able to deal with people, and lots of times one of the biggest problems is they have no filter. And what that means is they just blurt out everything that's on their mind. Ugh, that is an ugly shirt, or whatever. Because that's what they think, it's an ugly shirt. But, they don't know that they need to stop that, because their brain has that part in their brain that teaches them about the reasoning about, maybe I shouldn't do that, has been affected by the stroke. So it's a huge learning process for them, and it can take a long time. But if you have the family working along with them, and it's also educating the family, look, when your mother or a father are saying these things to you, they just can't control it. So don't take it as personally.
And that also with the students I work with as well. I have a lot of students that will just come out and say things to me like, oh, your hair is a mess today, things like that. And we have to teach them that, hey, you can't just say that to someone, especially in the high school. You can't go up to a girl and be like, boy, that's an ugly outfit. You just can't do that. So we try to teach them different strategies for that. I do have a student as well, like socially, that likes to walk around a lot and likes to memorize things. So he or she was finding out where people lived and was walking around the community to these people's houses. So we had to say, hey, you can't just walk up to somebody's house that you don't know, just because you Googled them. That's a little scary. It's scary for that student. It's scary for the other person that they're walking up to. So that's a huge social thing we had to go through with a student, that we needed to make up a social story on it. Like, we just can't walk the streets of Bethel and find people's addresses and go up to their house. That's just not appropriate. You just don't do that. So those are just different things. And it takes a long time for those kids to even grasp that they can't do that. They're like, why? Why can't I walk? Well, how would you like that student to show up at your house? You just have to, it takes a long time. Have to teach them just different strategies and need parent involvement on it as well.
Parent involvement's huge. Feeding and swallowing, we've kind of talked a little bit about. This is one of those aspects where you will be probably working with the doctors, and it's kind of exciting. I personally would not be able to do it at this point because I'm so far removed from it. If I wanted to go back into feeding type of therapy, I think that I would really need to take some more courses and do a lot more job shadowing. You're going to be working at the hospital, where you're going to be doing what's called a barium study, where you're basically watching. Ooh, we were pointing by.
We did a job shadow together.
Did you?
Okay. At the hospital, and we watched them do that test.
It's pretty exciting, isn't it?
It was really cool.
Yeah, it is really cool. And this is where your anatomy classes go into effect. I mean, you need to know exactly what's moving there, what you're looking at, what's not working exactly properly. So, now, how long did each test take? About how long?
Probably they gave them like various liquids, like ranging in thickness.
Mm-hmm.
We watched it on the I guess it was an X-ray. I don't know what it was.
Yeah,
like a screen that showed their throat, and if it like went into their lungs, they were aspirating. If it went into their stomach, they were all good. But each test took like 10 minutes.
Okay.
Were you at St. Clair?
Yeah.
Good. Now, lots of times it's very interesting and to know thinner liquids such as a water or iced tea is sometimes one of the hardest things for people to swallow. Does anyone know why? Did they talk about that? Yeah.
Because it's easier to aspirate if you drink one of those.
But why? Why is it easier? Why is it easier to aspirate on that?
It's really thin, so it can just like slide down
Yeah.
your throat. But, like,
It's moving much more quickly. There's less time for them to react, to figure out how to put their tongue to make sure the epiglottis goes over and closes off the throat so that the water all goes down into your esophagus. Very good. All right.
And a lot of times with that, when a patient is diagnosed with some type of swallowing disorder, they thicken their liquids or change their diet. My husband does that a lot at work, where they might thicken their liquids with like a nectar thickening solution, and it almost comes out like a pudding consistency, maybe almost like jello-y. I've tried it before. It's not very tasty. They could also soften like your regular food. It's like mechanical soft. It's almost like a puree, just so it's a little bit easier to swallow or you have more control over it.
Control is one of the biggest things.
And that's a huge thing I know that my husband deals with on a daily basis, is communicating with dietary at the nursing home to change diets. That's like his main job there, is changing people's diets, allowing them to eat, not allowing them to eat, which is huge when you're an adult and you've eaten things all your life and you're like, no, you can't have your coffee anymore, things like that. So there's a lot that goes into it. I know he doesn't like to tell people they can't eat, but it's for their health. I mean, they could aspirate, which could lead to pneumonia, which could lead to death. So it's a very medical part of speech pathology there.
All right, we're kind of running out of time, so I want to just real quickly, we'll go through these last ones. We've already talked about augmentative communication. That's using any type of device or anything other than your mouth to communicate. Augmentative communication can even be sign language. Phonemic awareness and reading skills. Just this past week, I did a lesson on rhyming in the learning support classroom, doing a little co-teaching thing. So we're also helping with that, because especially, who are you? You all should have had the letter people, correct?
Mm-hmm.
You have the letter people. Wonderful program, wonderful program. And it is so speech-based, because you're learning all those speech sounds as a kindergartner. Before we had the letter people program, it was just teaching the letters, teaching how to write them. That program is so speech-based. A lot of us speech pathologists work in the kindergarten classroom with the teacher because it is so wonderfully speech-based, and it's teaching all those pre-reading skills. But how many of my students will spell the word run, W-U-N, because to them that's how they pronounce it, one. So we're working with those types of skills. Hearing loss, cochlear implants, thankfully a big field anymore. When I first started working for the IU, I was working in deaf and hearing populations. That's where I was doing most of my sign language, teaching a lot of language, even more than speech, because children with hearing impairments, they miss all that peripheral language. If you think about a child, so much of what they learn is what they're hearing, not what someone's saying right in front of them. They're hearing what their parents are saying in the other room. That's why they learn all those swear words, and we think, how'd they learn that? I never said it in front of them, but you did. You may have been in the other room. So a hearing impaired child misses all of that. All they hear is what's right in front of them. They can hear you, but they're missing all that peripheral language. So their language is very limited, very literal. So there's a lot that goes into that.
And with that, you would also work along with a hearing therapist or an audiologist.
Yeah.
You would work closely with them to see what type of hearing loss they have, and just for your programming together, you would work as a team to figure out the best way of treatment for them.
Aphasia and traumatic brain injury, those are those types of things that you're going to be working with people that have had problems that occurred with the brain, usually, again, in a hospital type setting. Sometimes you're going to get those brain injured children in the schools, but it's after the fact, and then you're just working on the language types thing, and sometimes the speech.
I worked with a student here that had a TBI from a car accident, and when he was probably a few weeks out of the traumatic brain injury, he still just had word finding difficulty, would look at a chair and call it a stove, things like that. So that's what we worked on, is, getting that vocabulary back to him. And, he made great strides with it. He actually went to college. He has graduated now. So, everything's great for him, but those first few months after it, he wouldn't remember names of people, his family. everyday objects, go brush your teeth. He would grab a hairbrush, like had no idea. And and then he would get frustrated with himself because, hey, I used to be able to do this. I was an AP student, and now I can't even remember what a toothbrush is. So those are different aspects that you would work with. TBI, I know when I was in the nursing home, to me it's very sad to see that I worked with a lot of younger clients with TBI, and that's devastating to see after a car accident, things like that, just because your personality can change and you also you lose those words to communicate, and especially in young people, it's tragic to see.
And then the last part we kind of talked about was the different schools that we know of presently that offer the program. Does anyone have any questions? Really?
Yes, I do.
Okay.
As far as the schools, do you find that it is easier to enter a school like a Clarion or California that has the masters that you simply continue in? Or is it just as challenging to get in if you did your undergrad to their graduate school?
I believe it's easier to get into the master's program if you went to undergrad there. They leave more spots open for their own students. I went to Clarion for both the undergrad and masters, and they would leave, if they had 40 spots for your masters, they would leave maybe 25, 30 spots open for their undergraduate students and only take 10 or 12 students from another school.
Now, I personally believe that it's actually good to switch schools because then you're getting a different ideology. When you're being taught your undergrad, a lot of your same professors are going to be the same professors as your graduate professors. So there's different, types of teaching and teaching styles and thought processes that go into things. And so if you're stuck there, you might be sort of pigeonholed. Like, I like the fact that I've worked in lots of different places because I have lots of different experiences and different ideology from different sources. But that's not to say that you can't get a good education there, but if you have that opportunity to switch, it might be a good idea. I would think that an employer might look at that and say, oh, look, she was able, or he, excuse me, we're pretty female dominated, very few male speech pathologists, so you really should look into it.
Hiring?
Yeah,
It
I
is.
think that would be very good for hiring, especially in the schools. Through the IU, again, very few males. So just like in elementary education, being a man is usually going to be a benefit.
And my husband said the reason he went into it is because all of his classes were full females. So it was great. He was the only male in the class. So another bonus. Salary-wise, like in comparison, my husband probably makes equivalent to what I make here. He's been there for the same amount of time, 14 years. I'd say it's
starting in a
between 45.
Okay.
Hospital, I'd say around, it depends on where you're at. My husband's through UPMC. I would say starting is maybe around 50
Okay.
there. You also get increases every year in the hospital as well.
And then topping out?
Topping out, like comparison to my husband, I will top out higher than he will.
Okay.
But it also depends on what type of facility you're in and what your job is there per se. I mean, my husband also, as well as being the speech pathologist, he is the rehab manager, so he also oversees the PTs and OTs and sets their minutes and everything for each day, like how many minutes through Medicare, that type of stuff that they're allowed to get. So he also has like a stipend on top of his salary for doing that. So those are just some other options. And don't feel like if you want to work in the school, but you also like healthcare, don't feel like you have to be stuck in the school. I know when I first started, I also worked at Manor Care on the weekends just to keep up those adult skills. It was great extra money. And it just gave me an option for if, hey, in 10 years, if I'm burnt out from working with children, I can go into an adult setting.
Any opportunities in private setting where you can be doing this on that side?
There are. Clairvats, Crossroads Speech and Hearing, the Children's Therapy Center, those are all private.
And I mean, there are opportunities for private tutoring as well. But you have to also have that business mind, which I don't have. But I've worked for Claire Vatch. She has a private clinic, and done some PRN work for her. So.
My biggest suggestion would be, if you are truly interested in this, is to shadow someone. Shadow someone in the school, shadow elementary, shadow middle school, high school. Go to a hospital and shadow someone, or even a nursing home setting, just to see if you truly like this, if it's something you want to go into. And maybe you'll get a feel for, hey, I really like working with adults, or I really like working with kids, or, oh, I can't stand to walk into a nursing home, I never want to work there. That really can help your decision as the direction you want to go.
One of the biggest downfalls for any job would be the paperwork, and it just keeps increasing. When you're working in the hospital setting, you have to write almost daily notes, weekly notes, in a very organized fashion to get the insurance or Medicare to pay for it. Here in the schools, we're killing trees daily by writing all the paperwork that we have to write. Sometimes I feel like I write more about all the wonderful things I do with my students than I actually do, because you spend so much time doing the paperwork. You have to have very good organizational skills to be able to get it all done and see your kids.